Good afternoon, everybody. I'm Ching. Today, we have a special guest with us. Is Dr. John Juhl. He is my husband, and the reason I invited him to be with us is that a lot of time I see him treat patients or talk about methods, or sometimes our relatives and friends will consult him asking questions related to this current issue or in general health. And he has a lot of great ideas. And so I thought at this time, perhaps he can help us. He could give us some of his insights and his knowledge and his specialty, so everybody can benefit from it. I'm hearing a little feedback, so I'm going to put my headphone on. Hello? Can you hear me, John?
Yeah.
Okay, great. So, thank you for coming. Oh, we have 6 people. Awesome. And you're welcome to write your question on the chat, and we'll try to monitoring it and then answer your question. So this is called How to Stay Sane and Healthy in a Pandemic World. And so let's say hello to Dr. Juhl. Hi, Dr. Juhl.
Hi.
So I would like to first, although a lot lot of friends of mine, they know he's a doctor, but he's kind of a really low key guy, you know. He doesn't talk about himself very much. So today, I'm going to ask him. So, could you please tell us a little bit of your background, please?
Sure. For those of you who don't know me, my name is John H. Juhl, D.O., which is an abbreviation for Doctor of Osteopathy. I actually worked as a modern dancer in New York City for 10 years before going back to school to get a second bachelor's degree in biochemistry, and then went to medical school, did an internship and a 3-year residency in family practice.
I danced for 10 years with a modern dance company, with Elio Pomari Dance Company, and did a Broadway show on the road of Jesus Christ Superstar and a few other small gigs around, and played with a rock band for a couple of years before I came to New York. So
awesome. So a lot of time when somebody asks me like what kind of doctor are you, and I say you are DO, and then people have this really puzzled look on their face. Actually, like I would say 8 out of 10 people, they don't know what is DO. So can you briefly tell us what is a DO compared to a MD?
Well, DOs are fully licensed in all 50 states as physicians, and to the degree that there's a difference, DOs try to focus on helping the body to heal and repair itself, whereas MDs are allopathic and they focus on treating disease. Sometimes those overlap completely, and other times there's a real difference in terms of our approach. So osteopaths developed all these different techniques for freeing up the body's energy and musculoskeletal system, and a lot of that was borrowed by the chiropractic profession, and I would say probably anywhere from 1 in 3 to 1 in 10 DOs still do traditional osteopathy, which is utilizing those manual skills to enhance the body's ability to heal itself.
Okay, great. So what's going on right now with this, city shutting down, restaurants shutting down? What about doctor's office? Tell us a little bit. Are you working or are you not working?
Well, for the last few years, I've worked on Fridays down on Wall Street at Brian Waldron's office, New York City Osteopathy, but that office is closed. The other 4 days a week, I work up in Rockland County at Integrated Medical Care, and we are open and closed from day to day, depending on what kind of a patient turnout we have. So I'm still up there at least 1 to 2 days a week.
Okay, great. So now, what can you do? What can we do to protect ourselves from this disease, from this virus, from this craziness?
Well, social distancing to the degree possible and hand washing, everybody knows about that. Something that I didn't know until recently is that soap actually breaks up the outer membrane of the virus. I thought you were just washing it off, but it's actually killing the virus. And I just didn't know that until a week or so ago. So that's your basics. Then, there are 3 or 4 other things that I'd like to go into it, at some point today. You're going to, use a mask when you're outside, and masks that are made with some paper in them are better than woven scarves. So right now, with the recommendation that everybody wear a mask when they go out, there's a real shortage of masks. So you really need to know how to make your own mask at home, because you can't count on going to your local CVS and picking up masks there. Ching has a great 1.5 minute video on YouTube under Juhl Media for how to fold a napkin into a mask. And if you take a regular dinner paper napkin, 4-fold paper napkin, you can fold this by those instructions, and makes a fairly decent mask. My favorite is to take a couple of Melita coffee filters, a number 2 and a number 4, and put the 2 inside the 4 like this. And then I staple a couple of looped rubber bands onto the upper third of the number 4 filter, and on each side. And that gives you a double layer of paper to breathe through. And if I put it on my face, it's sort of shaped to the face. And you can see the paper moving in and out as I breathe. So it works really, really pretty well. But Melita number 2 and number 4 coffee filters are the basis for that one.
And sideway, let's answer a sideway question, not directly related to mask. Sue, our friend in our building, asked, how do we keep our bone health?
Bone health.
Mm-hmm.
Well, you want to be physically active, because even just walking helps to keep your bones strong. You want to have some basic building blocks of bone in your diet or as a supplement. That's calcium, magnesium, vitamin D. And there are 2 active substances that I have some experience with that are especially useful for women who are postmenopausal and who have lost bone density. And that is strontium, which is a mineral, and vitamin K. And I have more experience with recommending the vitamin K to people, and then actually following them out for a year or 2 and seeing their bone density actually increase. And the product that I've the most experience with is the Life Extension Super, K1, K2. Vitamin K is like a family. So there are 3 or 4 different members in the family. And the most active form is the K2 form. And there are a few different K2s. But the Life Extension Super K1, K2, I've had experience over a number of years with actually having people start it and then retesting their bone density a year or 2 later and seeing it actually increase. So the only contraindication to taking vitamin K is if you're also taking Coumadin, which is a blood thinner. But that's rapidly being replaced by a number of other blood thinner drugs that don't have the same mechanism of action. So to answer your question, basic building blocks and vitamin K, especially K2.
Great, thank you. So now you mentioned life extension a lot, and I see you buy them a lot. We're not, promoting the brand. We don't get paid to do that, but I just want people to know why you are using life extension more than other brands.
Well, it took about 10 years for me to gradually go over to using mostly life extension products. And the reasons that I moved in that direction were one, it's a nonprofit. It's been around for over 30 years. It publishes a magazine every month with references. So if you want to find out why a particular author presents a certain opinion, you can look at the references that they list. So for me, that's very helpful rather than just having an opinion thrown out there. Because it's a nonprofit, their cost is very close to what it costs them to make. And they have a number of sales throughout the year, and their quality control is excellent. You can call them up and ask them, well, how do you process this product? Where do you get it from? How do you know it is what you say it is? And their quality control is excellent. So I feel really comfortable with recommending various of their products to friends and patients just based on their quality control alone.
Great, thank you. Yukiko has a question. Is that true that touching face is the highest risk to be infected by the COVID-19 virus?
No, I don't think it's the highest. The highest is breathing in air that has virus particles in it, which is why they've made this new recommendation that anyone going out should wear a mask, more to protect other people from you than you from other people. But you do get some benefit by wearing the mask. But most of the transfer of the virus is happening through the air. To some degree, the virus can live for a few hours to a day on different surfaces, and that's a pretty gray area. And if you touch that surface and then touch your eye or suck your thumb or pick your nose, you could theoretically transfer the virus from that surface to your mucous membranes. But I would say that by and far, the biggest way that the disease is transmitted is through particles in the air, and especially by an infected person coughing or sneezing nearby.
Great, thank you, Yukiko. Now, it's one very I'm very interested in every time you talk about how to boost, how to support immune system. Can you please tell us about that?
Yeah, immune support is going to vary based on a person's genetic and medical history and nutritional intake. And here are some general guidelines. One, a decent multi should have 200 micrograms of chromium and selenium and 10 to 20 milligrams of zinc. So you kind of can cover that with just a multi. But a multi doesn't have enough C or D or other things in it. It's usually just a B complex. And whatever space is left, they put a tiny little bit of other things so they can put it on the label. Vitamin D3, 2,000 international units a day is enough for most grown-ups. And vitamin C is probably the cheapest, easiest way to support your immune resistance to COVID and other infections. Many of your white blood cells are wandering around your body kind of half asleep until they bump into RNA or foreign RNA or DNA or a germ, and then they wake up. And when they wake up, they increase their intake of vitamin C tenfold. So Linus Pauling, who's passed a number of years ago, the only person I know who's won a Nobel Prize in 2 different areas, did a lot of research on vitamin C, and he looked at animals that make their own vitamin C. And just for a little background, humans, fruit bats, and guinea pigs are missing the last step in making vitamin C. So we are dependent on getting it from our diet, from outside. But all the other animals make their own vitamin C. So he looked at all these other animals and figured out how much C it would take to get the level that they have in a human. And he came up with 18 grams a day. That's 18,000 milligrams a day, which is more than most people can tolerate. The bottom of the optimal range might be as low as 1,000 milligrams a day. And again, it probably varies from person to person. Vitamin C is being used intravenously in a number of hospitals in Italy and the United States to treat acute COVID patients in the hospital. One of the spokesmen for Northwell, which owns 23 hospitals in the tri-state area, including Lenox Hill Hospital, says that vitamin C intravenous is being widely used, but the protocols vary based on the doctor and the hospital and the patient. But we want to try and come up with what's a reasonable amount for a given person. And I've tried to sort of break that down into your risk factors. So for prevention, and if you're at low risk, 1 gram or 1,000 milligrams 1 to 2 times a day. For prevention, when you're at higher risk, first you need to find out what your bowel tolerance is, because if you take too much vitamin C at one time, it can give you diarrhea. So you can try taking 1 gram or 2 grams or 3 grams and see what you tolerate. And then for one example, you might take 1 gram anywhere from 2 to 6 times a day, or you might take 2 grams every 2 hours throughout the day as tolerated. So that's for prevention at higher risk. Then the next category would be you're positive for COVID-19, but you're at home and quarantined. And there it will be similar to prevention with higher risk. You want to try and increase that. But what's really important for persons who have COVID and are quarantined is that you do deep breathing exercises. And there are a number of people showing you how to do those on the internet. One is the dailycost.com. Another is at Chris Cuomo, and there are others, but basically it's breathing deep into your belly for, let's say, 4 counts, holding it for 4 counts, and then breathing out. Because the disease is most dangerous when it affects the periphery of your lungs. So you want to try and keep your your ability to breathe deeply enhanced as much as possible. Another thing that might be helpful for someone who's got COVID-19 and is quarantined at home would be to buy an Spirometer. They're usually made out of plastic, and you breathe in it and it measures your air force. So that's a way of measuring your breathing capacity at home. And as long as you can keep that stable and steady, you're kind of okay. If it all of a sudden drops way down, then maybe you need to call your doctor and see about getting more support.
Is it like the plastic thing? Like,
yeah,
I remember when I was after my surgery, they always make me to breathe in,
yes,
right?
mm-hmm.
It goes to shh, and then to see how much yeah.
Yeah, and the little thing goes up as you breathe harder and longer.
Mm-hmm. Yeah,
and you can buy those. They're not that expensive. They're relatively inexpensive, and I would say that would be probably your best measure of how well you're doing through the disease at home.
Mm-hmm. Yeah.
Now, the last group would be you're COVID positive and you're hospitalized. You're going to do the similar, try and get vitamin C and see if the hospital or the doctor offers IV vitamin C, because it's being used. And you want to ask about any antiviral drugs that the hospital may have a study going on. And some of those are hydroxychloroquine and Zithromax or Z-Pak. Another drug that's not on the market yet is remdesivir, but there are studies ongoing, and so you want to find out in your hospital if they are using any of those things, the IV vitamin C, and any studies that they're doing of their own patients using different antiviral drugs that they're hoping will work. So that would be your fourth risk category. The worst is your COVID-19 and you're hospitalized.
Mm-hmm. Yeah. Great. Now, so can we talk about testing?
Sure. Right now, at various places, and it changes from day to day, you can go and get tested with a nose swab. They put a swab up your nose. It goes up pretty high. I was surprised when they did it on me. And then they take the sample and send it to their lab, and the turnaround can vary from 2 to 10 days. Hopefully, it's going to be getting closer to 2 days. They're talking about a 15-minute test, but I haven't seen it yet. But that measures the presence of the RNA of the virus. And that tells you whether you're acutely infected right now. Now, one note of caution, you want to wait at least 3 to 5 days after you think you develop symptoms before getting tested, because if you test too early, you may get a false negative, meaning it says you're negative, but there just wasn't enough there for it to measure. So at least 3 to 5 days before you go for the swab test. The other test that's being developed now is an antibody test. Antibodies are something that your body makes in response to the virus. And that's going to be really important when we go back to work, or we're reducing the social distancing, because with that test, if you have antibodies to COVID-19, it means that you're probably immune to it. And if and when we get a vaccine, then if you have that test a month after the vaccine, it should come back positive for antibodies, showing that you will have that immunity then after a vaccine, which is still 6 to 18 months away. So those are the two kinds of tests that are available now. Now, if you go to an emergency room or a doctor, they're going to check your white blood cell count. They're going to check this. They're going to check that. But those are the two tests that that relate specifically to COVID-19. The nasal swab, which you can get at different drive-throughs and places around the city. In Rockland County, there are two drive-throughs, one at Anthony Wayne on Palisades Parkway, exit 17, and another in New City. And you call them up, you make an appointment, you go in, they swab you, you're gone, and you never even get out of the car in the drive-throughs. So those are the things to stay stay up on, and also any drugs that they decide are effective enough to be used acutely. That's my hope, is that they'll find some drug or combination of drugs like what a person with HIV takes that will essentially make the viral load non-existent or non-measurable. And it's not like we don't have antiviral drugs. We've got a bunch of them. So what we need to do is find one or a combination of some that will treat acutely, because that will give us a lot more flexibility in terms of going back to work and going on the subway and the bus and going out to a restaurant and things like that.
Yes. Look at your private chat, John Juhl. Okay. So we have another question from Peter. Peter, hi, how are you? What are believed to be rate of infection for COVID-19 and the fertility rate of COVID-19? Do you know that?
The fatality rate.
Fatality.
The fatality rate varies based on the location, where you are, and where you are on the curve. And if you've been watching any television at all, they're talking about it multiple times a day. Andrew Cuomo has done a really great job of explaining what the relationship between the rate of infection, which is going to be based on the amount of testing that's done, and the fatality rate. The fatality rate tends to lag the rate of infection. So even though the number of patients being hospitalized in New York City went down for the last couple of days, the fatality rate is still stayed pretty high, and because it lags behind the infection. It takes anywhere from, typically a person is going to be positive for the test by 50% of the people are going to be positive for the nasal swab on day 5 after exposure. But infection rate, we'll have to wait to find out much, much larger numbers of testing to find out how many people were asymptomatic. They had COVID, they didn't even know it. They thought they just had a cold. And then we can start to come up with a reasonable rate of infection. But at this point, we still don't have enough data yet to get a real number on that. So we're basing the rate of infection on the number of people that go to a doctor or get tested. And at this point, we're still pretty far behind on being able to test large numbers of people. By large numbers, I mean, in the state of New York, 10,000, 50,000 a day, something like that, until we can find out what the presence is in the larger population, not just the ones that are coming in symptomatic. Does that answer your question?
Peter is a math professor.
Yeah.
His question is very data-driven.
So, we need
Peter,
more testing.
You met Peter before,
Yeah.
right?
We need more testing to to get some idea of what the rate of infection is in the population, because we don't know how many asymptomatic people have had the virus and got over it. So that's problem one. The fatality rate in New York, they're in the last day or so, they've just decided to adjust it because they were only counting the fatalities that of people that died in the hospital and that have been tested. They weren't counting this large increase in people who were dying at home. So they could look at 20 years of data on how many people die at home in their bed on a given day or a given month. And that number has gone up very largely, matching the curve of the pandemic. And so they're just now starting to add in some of those at-home deaths into the fatality rate. So you can see how these numbers are really very pliable and are going to be modified constantly until we get a much better handle on the total picture.
So I have a question about test. We'll talk about testing. So now, how come you went to get a test? And say you are negative now. What happened? Like shortly after you get a negative test and you are exposed to someone, then you don't know.
Right.
And you can still, so it's like this cycle goes on forever. I mean, it's like
until you make antibodies. And that's why that antibody test that's being developed right now is so important, because it means that if you make antibodies, you made antibodies to measles, mumps, to 16 different kinds of H1N1 viruses and things like that as a child growing up. So you have all these different antibodies, but when we can measure antibodies to COVID-19, that will tell you, okay, I'm in the clear relatively, unless my immune system completely crashes, I'm likely to be immune. But yes, you are correct. If you get tested negative for the RNA virus yesterday and you get exposed today, that test would probably still be negative for another few days, but then you could get the disease.
Yeah, scary. So how do you when you go to work, you still go to work, maybe not every day, but maybe 3 times a week. What is your how do you feel? Do you feel fearful, or do you feel you're saving lives? Do you what were you thinking when you go to work?
Well, I think
I never asked you this before.
I'm functioning as a doctor, and to the degree that there are patients that want or need to see me, I'm happy to be able to offer that. On our front door, we've got a sign that says, if you think you have COVID or if you have a fever or cough, please don't come in. Go to the urgent care next door. And inside, we are all wearing masks, washing our hands, and wiping down surfaces all day long. But underneath all of that, when I first went into medicine and I realized that I was going to be dealing with sick people a lot. And the way I came to manage that is that I was going to assume that my good germs were stronger than most people's bad germs, so that I wouldn't go home and be anxiety provoked all the time about who I just saw and where. Again, and it comes back to, relative risk. I would say I'm at slightly higher risk than I'd be the number 2 risk category, based on the fact that when I go to work, I am seeing 4 to 6 patients a day. But I have to believe that as a general rule, my immune system is going to be strong enough to handle whatever comes. Otherwise, I would be terrified and afraid to do anything. And that has to be true for a lot of the other first responders out there that are in a far more higher risk category than I am. They hopefully have the N95 masks. They hopefully have the gowns, the gloves, maybe even goggles. So that's why I discourage people at low risk from buying N95 masks right now, because we got to leave those for the first responders who are out there really risking themselves and their families by running the trains, running the emergency rooms, and running the intensive care units.
Okay, thank you. Go back to immune. That's my interest the most is immune support. You mentioned about vitamin C, right? There's two more things you said one need to have.
Oh, let's see.
Yeah.
Well, we talked about breathing exercises. That's really important.
No, I'm talking about supplement.
Okay. The other one that I would we could talk about is your natural killer cell function. Natural killer cells are a small subset of your white cells that wander around your body, and they're not dependent on an antibody response. They react to foreign DNA, RNA immediately. And as we get older, there's a tendency for our natural killer cell function to go down. There are a number of different compounds that claim to increase natural killer cell function. I'm not talking about the number of cells, because we've measured that for 25 years, but the function of the cells. So the one that I've had the most experience with is a life extension product. It's called Natural Killer Cell Activator. And I've had the opportunity of having a patient who's prone to sinus infections or something like that. We measure their natural killer cell function, which is a test ordered through Quest Labs, and you have to have it drawn on a Monday to Thursday morning, because the sample has to go to California and be tested within a 24-hour period, which is pretty amazing, because they're actually measuring the function of those cells. So I've had the opportunity with that and a couple of other products of having a patient measuring their function. It's low, having them start it, and then a month or 2 months later, remeasuring it and seeing that number go up. And that's just a number. But when it correlates with their having better or less symptoms, then I think that's really significant. So I've written up a whole list of substances that claim to increase or facilitate natural killer cell function, but I only have experience with that and two others. One is a low-dose naltrexone, and I think I tried that with 2 patients, and I can make that available to anybody who wants to look at the list. But as I say, the one that I've had the most experience with is the Natural Killer Cell Activator. And I would say that comes, under the 3rd risk category, or the 2nd, depending on how concerned you are. Is that helpful?
Yeah. Yeah.
Yeah, which kind of gets us around to anxiety and worry. Like, what are you doing, Ching, to stay sane and hold up at home?
Yeah. Well, the nature of my work has been, a lot of times stay home, doing a lot of digital stuff. And So to me, it's not like a super torture to not go out. But when someone, said you shouldn't go out, yeah, and then it becomes like, I'm naturally I like to break rules, and I like to I don't like, someone asks me not to do this, not to do that. So that feels psychologically there is a restriction, and it feels some kind of suppression. Yeah. Therefore, that's for sure. Then I always try to, I don't know, for social distancing practice, or for just self pleasing pleasure, I do a lot of silly things. I I run, my stairs, our stairs go from our floor down all the way, then come back and down all the way, come back. And I'll sing Chinese folk song and I record myself. So I do a lot of video thing. I record my cooking. I record, I make, short videos. Normally I don't make, I don't know, just like talk to people on Facebook. And also another thing is I try to talk to one person, at least one person a day, like video talk, video chatting. I find when you look at someone to talk is different than you just talking on the phone. There is something more energy is passing. I feel when you look at the screen talking to this person. And also I have to look good, I have to take a shower. I have to make sure my hair looks good before I talk to them, right? Otherwise I'm just in my pajamas and really sloppy and stuff like that. So I don't know, I'm just chuckling around and try to find positive things to do and messages to pass, like having today this talk. I want people to know you. Your light is really dark. You may want to pull the curtain. I can see you, John.
Okay.
Yeah, because the sun sort of goes in and out. So yeah, I do a lot of things with my youngin, and do youngin talk chats, and that also gives me a lot of pleasure. So simple pleasure. Yeah, thank you. Oh, we have a question here. Do you think the fear and panic is making, let me put it here. Nick's question. Do you think the fear and panic is making body pH go acidic for people, that makes them more susceptible to illness and thereby what's the other word?
Pre-existing, exacerbating.
What's that word for?
Aggravating. Exacerbating pre-existing conditions and comorbidities.
The word master is here. Okay, so John, your face is too dark. Can you please pull the finishing blind up, because we can't see you. You're kind of dark. Sorry, I'm a videographer. I'm. Yeah. Okay, that's better.
Okay.
So, yeah. So what's the question?
Well, it comes back to, how can you stay sane during quarantine? Fear and panic can affect your immune system and certainly your state of mind. So the first thing is make changes in factors that you have some control over, and try not to obsess about factors you can't control. That's a place to start. You can do slow, deep breathing, 4 counts in, hold 4 counts out. You can do yoga or Tai Chi or some other home exercise as a way to reduce your panic or your anxiety. And as Ching mentioned, you can call or Zoom to significant persons in your life. And so I've been in contact with my cousins, with my uncle, with my brother, with my stepbrother, and and that's really another way of opening your world back up and allowing you to not get trapped in your own panic and fear.
Thank you. Great question. So, well,
I didn't
anything
really,
else?
I didn't really answer the thing about acidic pH.
Yeah. So the pH. What is
Yeah.
that?
Well,
What is that?
pH is a measure of acidity, and our bodies maintain a pH very close to 7, which is neutral, all the time. It may vary by a half a unit down or up, but I'm not aware of anxiety affecting pH. And we've got all these systems to neutralize things, to maintain that balance, and we keep it in a very narrow range. So I don't worry too much about my blood acidity. The only group that might be a problem for would be diabetics or people with chronic renal failure or close to chronic renal failure. Those are the only small groups that where acidity might be an issue, but I'm not aware of emotional condition affecting body acidity.
Thank you. Great. So, yeah. Anything else want to talk about? We're good.
You want to talk about your folding masks
No.
video? Okay.
Oh no, that video is on 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 YouTube. People can. I don't know if I can pull the video. I don't know.
So people go to YouTube and then they go to Juhl Media, and then
Yeah.
they look for this thing about a mask, folding a mask. And
Yeah, they're gonna see. No, let me try. Okay, I'm just getting my video now. Now I'm I'm now copying it. I've never done this before, so with nice music. So I put it in the chat. Let's see if it shows up. So I put it. Yeah, I put the link in the chat. But there is a way to like play video while we chatting. Yeah. Do you hear the music?
nope.
Oh, okay. So it's not from your end. Yeah, I just put the link there. It's a yeah. Hi, Tracy. Tracy is here. So yeah.
Hi, Trace.
But that video, some people said, the material is not, it cannot really, how do you say, the virus will still come in because it's just a piece of thin cotton. But I think
and I mentioned this earlier, is that woven fabric, the space in between the weave is fairly large. But if you take that 6 by 6 inch paper dinner napkin, you can fold it the same way that Ching is doing with her cloth napkin, and I think it would be more effective.
right.
So that's why I showed you the
Yeah.
dinner napkin and the dinner napkin, and you open it all the way up, and then you fold it the way she folded, and that's a backup. It's better than nothing, and the paper I think is better than the fabric.
Right, backup, yeah. And also, a lot of time, I think that for me to spend time, actually, I worked on this 1 minute and 35-second video for an hour. It is to make sure the music goes right and angle goes right. Even in the end, I still don't think the video is really what I want, but I think it's just a symbolic thing that I'm finding things to do. I'm finding fun things to do, and by folding a handkerchief, try to make it correct. the folding itself and videoing itself is a active activity that I make myself happy. Just that, it's worth it. I mean,
Yeah.
some people are very critic about anything, you know. There's, oh, you know, this material is useless, you know. Yeah, well, you know, just let me have some fun. And I love the music. I happen to find
I think it's really cute. I
yeah,
like it.
yeah. Let's see. Someone made a comment on the video and recommended you include interlude when making masks. What? Into what? Wait. Let me put it in. Nick, word masters here.
Interlining when making masks.
Oh, okay. Put
Yeah.
another line.
Well,
Yeah,
interlining would be another layer.
yeah,
So
yeah.
when you're using the paper, by the time you finish folding it, you're breathing through 3 or 4 layers of paper. With my Melita coffee filter, you're breathing through 2 layers of filter, which is, as I showed you, and it fits the face very well. It's better than nothing.
Right,
Yeah.
right, right. Okay. Does anyone have any questions? If not, we are going to leave soon. And let's see.
Be well.
Any questions? Yeah. So I would like to portray more people in the future, and so if you have some ideas you want to chat with me, and you're welcome to contact me. I'm going to show Chris Power, who is making masks actually for hospitals at home. She's in Ohio, and she is my Facebook friend. She was John's friend from when they grew up, actually. Yeah, from Skyview, from Rockland County. Yeah, but so there's a lot of people out there, interesting people doing interesting thing, and so if you have any ideas or if you want to be chatting with me, that'd be great. So this video, people are watching right now. We have less than 20 people watching, and but also this is gonna be posted on my YouTube channel, Jewel Media, so people can come back to visit, and maybe John can put down a couple of numbers you were talking about, like immune system support, like a minimum vitamin people can take, just to prevention. Yeah, not to fix problems. Yeah. Okay. Thank you so much, you guys, for watching. Thank you. That was a good one, right?
So long.
Thank you, Dr. Juhl.
Bye.
Bye. We are ending the broadcast. Happy Easter, everybody!